The government is to undertake a renewed push for better lifestyle habits to help prepare for future health challenges. The announcement comes as the World Health Organization said recently that COVID-19 may be the first of many more deadly health pandemics. The health ministry says a review of the country's infection prevention protocols needs to be done, but the opposition is urging caution.
News that COVID-19 is likely to be the first of many deadly health pandemics came as no surprise for health experts. The man in charge of Jamaica's health sector, Dr. Christopher Tufton, believes it's not if, but when a new pandemic comes.
The history of the world and civilization shows us a series of pandemics or health risks that have literally brought the world to a pause. Lives have been lost and major disruptions have taken place. So I'm pretty sure that COVID-19 is not going to be the last. The challenge for us as a people is how do we mitigate or minimize the risks of these occurrences.
He admits there are shortcomings in Jamaica's current infection prevention framework, noting that a review is needed.
It has to be in how our society is structured and how we treat with our environment and with each other, because that will give us the resilience that we need. We have to learn from each occurrence, just as we learned from the Spanish flu. We have to learn from COVID-19. And issues around infection prevention and control are very important, and a major review of that has to take place.
He also laments poor lifestyle habits of many Jamaicans stymie the health sector.
The truth is, the biggest pandemic that we face that goes unnoticed is lifestyle-related diseases. We call them NCDs. 70% of deaths in the country are linked to that. So the cardiovascular disease, cancers, and so on. And a lot of that is how we live within our environment, our consumption habits, our lack of physical activity. And there is a way to structure society to provide better guidance and to nudge people in particular behaviors that are health-seeking.
He says the government will launch a series of initiatives this year to improve those drawbacks.
Exercise and balancing that. There are some things coming that we would like to push to start that process, looking at consumption of salts and sugars and trans fats, tobacco, abuse of alcohol. All of those may, on the face of it, seem like unrelated issues, but they really are connected to how we survive these threats when these threats become an issue.
But even as that happens, the opposition spokesman on health, Dr. Maurice Guy, wants the focus to be on the here and now COVID-19.
COVID-19 has put a significant damper on 2020, not only in terms of health, but in terms of economy, in terms of the way people interact, interface, in terms of education. So when you combine all of this, what we can speak to is only the present, but certainly one can speculate, yes, certainly in the future we may have greater pandemics than COVID, but the reality is that this is the one we are dealing with now.